So today, Henna and I will be discussing anosmia.
Good morning, everyone. So first we're going to talk about what exactly is anosmia. So it's the partial or full loss of smell, and it can be temporary or permanent condition. So you can partially or completely lose your sense of smell when the mucous membranes in your nose are irritated or obstructed, such as when you have a severe cold or sinus infection, for example, but in the inability to smell, that this isn't related to a cold or sinus infection, or it doesn't return after congestion clears. You should see a doctor, and it could be a symptom of another issue. The sense of smell is important to overall health and nutrition since diminished sensations can lead to a poor appetite and malnutrition, especially in the elderly patients. An altered sense of smell may pose other health-related problem. People with anosmia may accidentally consume sour or rancid foods because they are unable to detect the odors that signal spoilage. Those with anosmia may also be unaware that they are breathing in toxic or polluted or smoke-filled air. Although rare, some people are born without the sense of smell, which is a condition called congenital anosmia. This occurs when there's either an inherited genetic disorder or abnormal development of the olfactory system, so the body's sense of smell, occurring before birth. Unfortunately, there is no cure for congenital anosmia, and the term derives from the New Latin anosmia, an ancient Greek word. Another term related would be hyperosmia, and this refers to an increased ability of smell. Some people may be anosmic for one particular odor, a condition known as specific anosmia. And in the US, about 3% of the people over 40 years of age are affected by anosmia. Next slide.
So in terms of the cause of anosmia, a temporary loss of smell can be caused by either a blocked nose or an infection. In contrast, a permanent loss of smell could also be caused by death of the olfactory receptor neurons in the nose or by brain injury in which there is damage to the olfactory nerve or damage to the brain areas that process smell. The lack of the sense of smell at birth is usually due to genetic factors, and that's referred to as congenital anosmia that we mentioned earlier. Family members of the patient suffering from congenital anosmia are often found with similar histories, and this suggests that the anosmia may follow an autosomal dominant pattern. Anosmia can very occasionally be an early sign of degenerative brain disease, such as Parkinson's and Alzheimer's disease. Another specific cause of permanent loss could be from damage to olfactory receptor neurons because of the use of certain types of nasal sprays, like the ones that cause vasoconstriction of the nasal microcirculation. To avoid such damage and the subsequent risk of loss of smell, vasoconstricting nasal sprays should be used only when absolutely necessary, and then only for a short amount of time. Non-vasoconstricting sprays, such as those used to treat any sort of allergy-related congestion, are safe to use for prescribed periods of time. Anosmia can also be caused by nasal polyps. These polyps are going to be found in people with allergies, history of sinusitis, and family history. Individuals with cystic fibrosis can also often develop nasal polyps. And something interesting to note, just in terms of cause and just to introduce it briefly before we go into it later in the presentation. In terms of COVID-19, there have been reported incidences of loss of smell or taste. It's been the predominant neurological symptom of COVID as well. And it has been found that a survey of 2 million participants in the UK and US have been exhibiting these symptoms as well.
So the obvious or telltale sign of anosmia is the loss of smell. So some people with anosmia start to notice a change in the way things smell. So like an example would be familiar things begin to lack odor. If you experience a loss of smell that you cannot attribute to a cold or allergy, or which doesn't get better after a week or two, inform your doctor. Your doctor can take a look inside your nose with a special instrument to see if there is any polyps or growth impairing your ability to smell, or if an infection is present. Anosmia can have a number of harmful effects. People with sudden onset anosmia may find food less appetizing. Though congenital anosmics rarely complain about this, and none report a weight loss, loss of smell can also be dangerous because it hinders the detection of gas leaks, fires, and spoiled food. The common view of anosmia as trivial can make it more difficult for a patient to receive the same type of medical aid as someone who has lost other senses, such as hearing or sight. And many experience one-sided loss of smell, often as a result of minor head trauma. This type of anosmia is normally only detected if both of the nostrils are tested separately. Using this method of testing, each nostril separately will often show a reduced or even completely absent sense of smell in either one or both of the nostrils, something which is not often revealed if both are tested simultaneously.
So how do we diagnose anosmia? So if you experience any sort of loss of smell that you can't attribute to a cold or allergy, or it doesn't get better after a week or two, you need to notify your doctor. Because like Henna mentioned, the doctor can look inside your nose with a special instrument to see if there's any sort of growth or polyp that's impairing your ability to smell, or if you have some sort of infection. Further testing by a doctor who specializes in nose and sinus problems would be using an ear, nose, and throat doctor or an otolaryngologist. That can be needed to determine the cause of anosmia. Also, sometimes a CT scan could be necessary so that they can get a better look of the area as well. Anosmia will also be diagnosed by using acetylcysteine tests. These doctors will begin with a detailed elicitation of the history. Then the doctor will ask for any sort of related injuries in relation to anosmia, which could include upper respiratory infections or a head injury. They also utilize psychophysical assessment of order and test identification to identify anosmia. A nervous system examination is performed to see if the cranial nerves are damaged. The diagnosis, as well as the degree of impairment, can now be tested much more efficiently and effectively than ever, thanks to smell testing kits that have been made available, as well as screening tests with used materials that most clinics would readily have. Occasionally, after accidents, there is a change in a patient's sense of smell, so particular smells that were present are no longer present. So on occasion, after head traumas, there are patients who have unilateral anosmia, and due to this, like we mentioned, the sense of smell needs to be tested individually in each nostril. And then this chart is going to provide the guidelines for the clinical evaluation and outcomes for patients with anosmia. So it's basically like a flow chart just to see what we need to do after you have some sort of like diagnosis. So first we evaluate the medical history. You see how or when did the disorder start. You evaluate. So if there's no memory of olfactory function, then maybe that could be related to a congenital disorder, and then you treat it with any sort of like research options that are available. If there's some sort of trauma or severe cold, and then there's some sort of olfactory fluctuation, that could either be a post-infectious disorder or a post-traumatic. You treat it either with zinc gluconate or some sort of smell training. If there's a gradual onset, so there was no actual like triggering event and there's no olfactory fluctuations, it could be either neurodegenerative or something else, or even a sinonasal disorder, or it could also be a post-traumatic disorder or even post-infectious. So you see like the arrows go throughout numerous things because there could be many diagnosis factors into that. The ENT exam will also always include the nasal endoscopy. They will see any sort of olfactory cleft and detect endonasal pathology. If they do olfactory testing, you have to validate that test, and then that's when they use like those sniff tests just to see where the patient is at. And then, like mentioned earlier, CT scans, MRIs, or EEGs to see the volume of the olfactory bulbs and to see which type of nerve is affected. And then also you could use worst case scenario for treatment options, surgery, or steroids as well.
So if nasal congestion is from like a cold or allergies, then the treatment is usually not needed and the problem will get better on its own. So short-term use of over-the-counter decongestants may open up your nasal passages so that you can breathe a little easier. However, if it's a polyp or a growth that's causing it, surgery may be needed to remove the obstruction and regain your sense of smell. If you suspect a medication is affecting your sense of smell, you have to talk to your doctor and see if there are other treatment options available that won't affect your ability to smell. Sometimes a person will regain their sense of smell spontaneously. Though anosmia is caused by brain damage and cannot be treated, anosmia caused by inflammatory changes, like in your mucosa, can be treated with glucocorticoids. Reduction of inflammation through the use of oral glucocorticoids, such as prednisone, followed by long-term topical use of glucocorticoid nasal sprays, would easily and safely treat anosmia. The prednisone regimen is adjusted based on the degree of the thickness of the mucosa, discharge of edema, and presence and absence of nasal polyps. However, the treatment is not permanent and may have to be repeated after a short while. Together with medication, pressure of the upper area of the nose might be mitigated through the aeration and drainage. Anosmia caused by a nasal polyp may be treated by steroidal treatment and removal of the polyp, as mentioned in the last slide. Although very early in development, gene therapy has restored the sense of smell in mice with congenital anosmia when caused by ciliopathy. In this case, a genetic condition may have affected cilia in the bodies, which normally enabled them to detect airborne chemicals, and an adenovirus was used to implant a working version of the IFT88 gene into a defective cell in the nose, which restored the cilia and allowed for a sense of smell. So then, next slide, please. Sorry. So then we talk about anosmia in COVID, its underlying mechanism and assessment in the olfactory route to the brain. So a majority of COVID-19 patients, as we know, experience some level of anosmia, and it's usually temporary. Analysis of electronic health records indicate that COVID-19 patients are 27 times more likely to have a loss of sense of smell, but are only around 2.2 to 2.6 times likely to have a fever, cough, or other respiratory difficulty compared to patients without COVID-19. Some studies have hinted that anosmia in COVID-19 differs from anosmia caused by other viral infections, including other coronaviruses. For example, COVID-19 patients typically recover their sense of smell in the course of weeks, much faster than the months it takes to recover from anosmia caused by a subset of viral infections, which are known to damage the olfactory sensory neurons directly. In addition, many viruses cause temporary loss of smell by triggering the upper respiratory issues like a stuffy nose. The team focuses on the gene ACE2, which is a cell widely found in the human respiratory tract, and it encodes the main receptor protein that the SARS-CoV-2 virus is going to target to gain entry into your human cells. And they also looked at the gene TMPRSS2, and this encodes for an enzyme that's thought to be important for the SARS-CoV-2 to gain entry into a cell. The analysis revealed that both ACE2 and the gene are expressed by cells in the olfactory epithelium, a specialized tissue in the roof of the nasal cavity responsible for odor detection that houses your olfactory sensory neurons and a variety of supporting cells. Neither genes, however, were expressed by olfactory sensory neurons. In contrast, these neurons did express associated with their ability of other coronaviruses to enter the cell. Researchers found that two specific cell types in the olfactory epithelium express ACE2 at similar levels to what had been observed in the cells at the lower respiratory tract, the most common targets of SARS-CoV-2, suggesting there's a vulnerability to infection. These included substantial cells, which wrap around sensory neurons and are thought to provide structural and metabolic support, and basal cells, which act as stem cells that regenerate the olfactory epithelium after damage. The presence of proteins encoded by both genes in the cells were confirmed by immunostaining. And in additional experiments, the researchers found that olfactory epithelium stem cells express ACE2 proteins at higher levels after artificially induced damage, compared with the resting stem cells, and this suggests additional SARS-CoV-2 vulnerability. However, it remains unclear whether how this is important to the clinical course of anosmia in patients with COVID-19. However, the experience of anosmia without any nasal obstruction, and Data and colleagues also analyzed that the gene expression in nearly 50,000 individual cells in the mouse olfactory bulbs and the structure in the forebrain receives signals from the olfactory sensory neurons and responsible for initial odor processing. Neurons in the olfactory bulb did not express ACE2, and the genes that were associated with proteins were only present in the blood vessels, particularly pericytes. And these were involved in blood pressure regulation, blood-brain barrier maintenance, and inflammatory responses. And no cell types in the olfactory bulb express the TMPRS gene. Together, these data suggest that COVID-19 related anosmia may arise from a temporary loss of function supporting cells in the olfactory epithelium, which indirectly causes a change in the sensory neurons of the olfactory. And then the next slide is just our references.